Good afternoon, everyone. Sarah Barker with the Empowering Aging podcast. I'm very excited to have with me today Jenn Silagi from Homestead up in the Sacramento and Grass Valley area of California. I've had the great pleasure of getting to know Jenn for about a year now. And I think anybody that is in this industry enters it with a deeper why, and they have a passion for being here. But what I can tell you about Jenn is that she combines that compassion with an extremely high level of strategy on how to partner with referral sources in her territory. So collectively, they can work together to better serve the seniors within their homestead territory. Jenn, thank you so much for being my guest today.
Of course. Thank you for having me.
So let's dive right in then. So I've already mentioned that you work for Homestead, but why don't we start the audience out with learning a bit about your journey? So what is your background and what led you to getting into senior care and specifically Homestead?
Sure. When I was young, I remember being 15 and being at a funeral and watching people stand up and talk about this person who had passed and how they had impacted their lives. And this was a person who worked with women who were addicted to drugs, helping them to get clean and keep their babies and just become the people they wanted to be. And I saw that and I thought, that's what I want for my life. My life goal is to leave a legacy, make an impact so that I leave the world happier and better than it was when I came in. And so I went through this journey of trying to find, but what's my role in that, right? So I worked with some nonprofits. I did some work with veterans, and I worked for a long time for a pediatric nursing company with medically fragile children. That took an emotional toll on me. But what I found was working with their families just really hit my soul. Yeah. And so it was a natural progression to move into senior care because I still get to impact those families, but then I'm working with people who have lived their lives, who have these amazing stories to tell, who, they're getting to the end. Sometimes they're forgotten. And I love being there for them. I love helping their families and helping them navigate that. And so I just fell into it. I interviewed with Homestead, and my first interview was 2 hours long. My second interview was 2.5 hours long, just because we all had so much to talk about. And I loved the people and the staff, and the longevity of everyone that's been with Homestead spoke to me that this is the place where people stay and the place where people are fulfilled. And so I took the job, and it's been an amazing 8 years since.
8 years. So I know when I first met your particular agency, I was floored at the longevity of the staff. So you've been there for 8 years. And I know Symphony, who recently purchased her own homestead in San Diego, but she was with the company for how long?
13 years.
Right. And Lori, how long's Lori been there?
Lori, our care manager, has been there for 17 years. Our caregiver trainer, our care pro trainer, Lita, has been there also 17 years. It's not even just exclusive to, I think, our little world of Homestead. It's sort of all over.
I have noticed that about your particular franchise network is the longevity across the entire system.
It's a culture. It's a culture of inclusiveness. It's a culture of caring, of putting our care pros and our staff first. Because if we're fulfilled, then we are providing the best care possible for, the people in the community we're working with.
I was just about to ask about that. So the internal culture and how the staff feels treated cannot help but to improve the delivery of the outward care to those in the community. And I believe the tagline is still, to us, it's personal, right? So treating every family as though it's your own family.
Yeah. And every employee, every care partner that we work with, it's personal for all of us. Everybody needs to be fulfilled, and everyone has needs that need to be met. And so that's our goal.
I love that. And thank you so much for sharing the story about your journey. I was getting goosebumps the entire time about really your entire drive is to create a legacy and leave an impact on others. That's absolutely beautiful. So now your deeper why, we've shared that was part of the journey. Now, what are some indications? So anybody listening right now, and what we know from our years of experience is that unfortunately, many times we're not hearing from families soon enough, meaning we could have done a lot to alleviate the overwhelm and the stress that they're feeling sooner if only they had been sent our way or known to call us.
Mm-hmm.
So what are some red flags, some indications that adult children typically, right? Or it could even be an elderly neighbor looking out for their neighbor, right? What are some things they can look for to say, you know what, maybe I should reach out to Jen, or maybe I should reach out to that person in senior care in my area to ask some questions?
Yeah, there's so many different things because there's so much that an in-home care provider can do. But really, somebody who's falling down a lot, even if there's no injuries. I hear a lot from families, well, she fell 3 times last year, but she didn't hurt herself. But now she's broken a hip. I'm like, but if we got in there the first time, we can kind of help mitigate some of that. So falls are probably the number one indicator. And then isolation, loneliness. If your loved one isn't leaving their house, if they're they're not going to church anymore, they're deciding not to go to the grocery store, or they can't drive, things like that isolation. And we saw this especially during COVID.
Yes.
The more somebody's isolated, everything starts to decline. They're less active, so their muscles get weak. Their stamina declines, their cognitive abilities decline. So anytime anybody starts getting isolated, it's really time to start looking at some options.
Right. And not just the cognitive decline as we often think in the industry of, dementia, right? But we need to also take into consideration the mental health impact, the emotional impact of being isolated, and how that can lead to depression, right?
Yeah, and depression can really, especially in seniors, manifest like dementia. So you may start seeing confusion and forgetfulness and things like that. So looking for the depression, grief is another big one. And people don't always realize this. When mom and dad have lived together, been together for 60 years, and one of them passes away, grief often can look like the early stages of dementia. And so kind of heading that off during that period of time and having a companion for support can really help mitigate some of that and keep them in a routine so that they don't fall back and decline. Because a lot of times people will say, well, dad, passed away, and then 15 months later, mom followed him. But a lot of that is that grief can really cause a lot of decline and issues.
Right. And maybe you have some advice to, I've seen it with clients, I've seen it in my own family, is let's give some grace to people going through grief, right? Everybody has their own grief journey, the own time frames. And, I'm a believer that it doesn't ever go away completely, right? It becomes more manageable, or maybe less frequent, outbursts, so to speak, of this grief, but we cannot try to control somebody else's grief. And we have to hold that space for them, because you use that example. Somebody's been married for 60 years. I can't even fathom that, to have somebody, such an intimate part of my life for so long, just gone.
Yeah, it's hard. And then a lot of times adult children may decide, well, now it's time for big changes. Dad passed away. It's time to move into an assisted living facility for mom. Sometimes just having a companion and some in-home care during that transition time can kind of help get back to baseline before you start making really big changes and decisions.
What about some advice? Now, we've been doing this for a while, so we understand there are situations in which the adult children end up having to make an executive decision on their parents' behalf, because maybe they've lost capacity to make those decisions. But let's say that they haven't yet, right? And so do you have any advice to the audience about include your aging loved one in the decision-making process?
That's always important. Having them, making sure they know they still have autonomy over their life. It can really help, even if they're already showing signs of dementia. You don't necessarily, like, yes, you have to make the executive decision, but include them in the options. We have this, or we have this, or I want you to check this out. It really helps them feel like the adult that they are. One of the things I hear from clients all the time is, I wiped my kids behind and now they're trying to take over my life like I'm their kid. And I'm like, when it comes to us, our clients steer the ship. Like, their adult children may give us the expectations of care and what's needed, but we frame that in a way that our clients get to decide what that inevitably looks like. And we find that match and that pair so that they feel like they have control of their lives. Like, they're not children.
We're preserving dignity.
Absolutely.
Right. So one thing that I've heard many times over the years is this whole emotion around independence. And oftentimes the senior will feel, if they accept care in the home, that they are losing their independence. And what I've always liked to say is, our services are not about taking your independence away. We are here to help facilitate that independence.
Yep, that's exactly what I say. I tell them things like, you steer the ship. I remind them, if you don't use it, you lose it. So it's up to us to make sure we're not here to do your laundry for you. We're here to support you while you do whatever it is you want to do. But if somebody wants to come into my home and do laundry, totally come into my home and do laundry. But there's other home care things that I will always want to do for myself, and they're like that. They have a routine, and sticking to their routine is really important. And so we just kind of facilitate that. How can we help you stick to your routine? If you love going to Trader Joe's on Friday mornings, let us get you to Trader Joe's on Friday mornings. We're not trying to change your routine. We're just trying to help you do the things that you want to be doing.
Right. Meet you where you are in your aging journey and care needs journey. You mentioned Trader Joe's. So that's something that we would consider, yes, going and getting the food. And there's that companionship aspect with going with the care professional. It's an activity, right? And so can you speak to the audience about how home care, if it's a good caregiving agency, it is not about just sticking warm bodies in the house. It's not just about the activities of daily living, right? It's about looking at that entire person and saying, how are we going to make the senior's life safe and better, right? Maintaining or increasing the quality of life.
Yeah. And helping them do the activities that they've always wanted to do. We had one gentleman, his wife passed away. His family kind of was like, well, maybe it's time for you to move into an assisted living. And he absolutely didn't want to go. So they brought us in, and 3 times a week we had a caregiver. We gave them another gentleman so they could be buddies. And 3 times a week they would go over to the assisted living community they were looking at, and they would have lunch. And then they would do whatever activity was going on after lunch. And this gentleman was 6'2". He had a full head of silver hair, 82 years old, silver fox. And he would sit at his lunch table with his caregiver, and all the ladies would flock to his table. And they would just sort of cycle through. And he just decided that he really liked the attention. And so he was like, yeah, I think I could live here. So after about 2 months, he moved in. He kept his care professional with him because that was his wingman. And they'd go out to the movies. They'd go do things so he could get out of the community. But it really helped him see that there was a life out there, that there were things to do, that there was still fun to be had. And he is currently one of the most popular gentlemen in that dining room.
I love this story, and your story touched on several things here, right? Which is one, it's sad, but as someone ages, right, later in life, their world becomes smaller and smaller, mm-hmm. right? Children have moved off, probably friends are passing away. Maybe their friends are moving to another part of the country to be closer to their own children and grandchildren. And so I could totally see how, if somebody in that situation starts to feel like they don't have anybody. And so what I like about what you just described is that we can be a key part of facilitating new connections for them, right? The other thing, I love that he was your client, but you guys were the ones facilitating an introduction to this community. You know, mm-hmm. He wasn't sure if he was moving or not, but you were supportive if that were to be the decision, and you helped to facilitate the exposure.
Yeah, I mean, we're always going to do what's best for our clients and for, the seniors out there. If home instead is the answer, then that's great. Home instead's the answer, but sometimes we're not, or sometimes we're only part of the answer. Mm-hmm. So we work with care partners in the senior industry to make sure that we give our clients the full experience, and so that their needs are met from all sides, whether they need hospice or home health, or we need to look at a community, or, a higher level of care management that what we can provide. Just, we really look to partner with the best people that we find have integrity and are doing this for the reasons that we are, which is to help people and to care about people. Mm-hmm. Our mission statement is enriching every life possible through extraordinary care. And when we say every life possible, we don't mean the lives of our clients. We mean their clients and their families and our care partners in the community and, everyone that we come across. And so, finding those communities that work best for our clients, if that's the answer, we're going to help them get in there, and we're going to make it as smooth of a transition as possible.
Right. You guys, so many know that I'm always preaching about this empowering aging philosophy. And there's not a single one of us on the continuum of care that can do it alone, right? To empower that aging process for our seniors takes all of us, right? And so, and I also like how you described how you guys operate. It's as if you're looking to establish a care advisory team around mm-hmm. each client. Now, so you had mentioned that the care professionals, once your client did decide to move into the community, the care professionals stayed with him. And I think it's important to make sure people understand caregiving services. We often only think about it as being provided in someone's residential home, but we can provide our care services anywhere.
Yep. Anywhere that there's a need. And, there's some senior communities out there that have called us to come in for a couple of days when somebody comes home from the hospital, because you spend a week in the hospital and you're in your 80s, your muscles are getting weaker, your stamina has declined, and you become more of a fall risk. Mm-hmm. So they may want us there one-on-one for 3 days just to make sure they don't go back to the hospital, and we're there to support them for that. We've gone into skilled nursing facilities to do one-on-one bedside sitting for dementia clients, mm-hmm. because their staff is, they work hard. They're all over the place. They don't have somebody that can sit there and make sure that, Mrs. Johnson stays in bed all day and doesn't have a fall. So, we're there to help out however we need to. And we can go pretty much anywhere.
Right. And consider that is in Miss Johnson's best interest, right? Maintaining that safety and more one-on-one attention, but also it's mitigating the liability exposure
for the community. Absolutely. The skilled nursing facilities, the last thing they want is somebody falling out of bed on mm-hmm. their watch. And so, if we can help them with that and work with them, we give them contact to our management team so that we're in constant contact and there's oversight, communication is key. I think when it comes to care, all the way across the board, communication is key. Communicating with the families, communicating with your care partners. It's so important that that's as seamless as possible.
Absolutely. Could you describe for the audience what the process looks like? So let's say somebody listening right now happens to be in the Sacramento, Grass Valley area and says, I've really been needing to talk to somebody about my mom or my dad or mom and dad, right? To understand what options exist and how this all works, right? Because you and I know, Jen, many times by the time a family reaches out, they really don't understand what the options are or what the process looks like. So here's our little case study here. Let's say adult daughter is listening right now and says, I really need to talk to Jen. And she reaches out and calls you. What happens next?
I ask to learn more. Tell me about mom. What's going on with mom? So that way I can figure out what the pain points are, not only for mom, but for the daughter too. At Home Instead, we always refer to the daughter as Kathy. So that's just kind of our general name for the adult daughter. So, I'm asking Kathy, what's going on with your mom and how is this affecting you? And how is this maybe affecting dad if he's still in the home? Or, because there's all these different things. And then once we're able to figure out exactly what the pain points really are, exactly, what the needs are, then I'm going to start making recommendations. So right away, I'm probably going to suggest that we come out and do an in-person assessment because there's no cost, there's no obligation just for us to come out and see firsthand what's going on. Sometimes seeing the environment, watching a transfer, things like that can kind of change our recommendations a little bit. And then I'm going to provide them with other resources. So if Home Instead's not the answer, there's several placement agents that we work with that we, really trust. So I might give that information out or make a suggestion for physical therapy or a home health nurse if that's necessary, and just sort of start to build that team and see what it looks like. I'm also going to ask Kathy, are you already working with somebody in the industry? Do you already have home health? Have you already reached out to hospice or talked to a placement agent? Because that person is going to have firsthand knowledge, and I'm going to want to reach out to them and include them in any recommendations that I make, which is really important. And we're just going to kind of blanket the family with resources and figure out what direction do we want to go. I may also ask about finances. What does your budget for care look like? How long can you maintain what you're looking at now? So because it's so important to plan ahead. A lot of families now, they decide to do what we in the industry refer to as a spend down, where they want to just kind of spend all their money in the beginning and then go on, Medi-Cal and get those kind of resources. And sometimes there's other options. There's other avenues we can explore. And so I'm going to provide those options as well to make sure that we're keeping within their means and we know what things are going to look like in 10 years. Or if you're 75, we may need to be looking 15, 20 years down the road.
Right. And we want to make professional care recommendations, definitely taking into consideration that budget, right?
Yeah, absolutely.
Because we want it to be sustainable. We don't ever know for sure, but the last thing we want to do is be working with the senior themselves. And they're like, yes, I want to stay in my home no matter what. But they need 24/7 care. They tell us that they can certainly afford it. But then all of a sudden we get the call 6 months later that they can't pay the bill. And it's like, did we do the right thing? Or should we have done more research up front to make sure that whatever the care plan is going to be, it will be sustainable, right? So we don't put people in a bad position.
Yeah.
The other thing is if we know maybe how many hours, right, how much care they can receive, but then as needs increase and hours have to increase to meet, the need for safety and quality of life, that's when we can know, okay, in-home care is not sustainable anymore, we have to bring in one of our placement partners.
Yep.
But it is, I really want to emphasize that, especially for any families listening. If you're ever talking to someone like Jenn and we're asking these very personal questions, it's all for a reason. It's all so that we can get some accurate information in order to make the proper care recommendations and get the right resources for you.
Yeah. And it's also, we can do the right thing, and that's, we have our laws of care, and number one is always do the right thing. And we're always going to, look for that. And how can we be the most helpful?
Is that a Homestead thing, or is that a Buck Shaw and Tanya Shaw office
thing?
That
is a Buck Shaw thing. He has our laws of care. We came up with them really as a team. The things that drive us in our decision making. And so it's things like always do the right thing, put our care professionals first, always have each other's back as a team. It's how can we work together the best with not just us internally, but everybody that we come in contact with to provide the best care.
I love that. Any home, Buck, I hope you're not upset, because that just went live across everywhere that you guys have laws of care. So it's out there now, but I'm sure some of the home care agencies listening are going to pick up on that golden nugget right there. This whole concept of laws of care, that's fantastic that you guys have that. Mm-hmm. It's kind of those drivers to drive the culture, right? And people's decisions and actions.
It's exactly what it is. And, it's really, it's what I love about Homestead. It's those principles that, drive our care, and the fact that we work for somebody who, makes that a priority, who makes doing the right thing a priority. And it makes it so we can all feel good about what we do when we go home at the end of the day.
Right. Because it's not an easy job. It's fulfilling, but there are definitely days of overwhelm in the positions that we have. So so I've mentioned Sacramento and Grass Valley. I have been in Sacramento once with you guys, but I can't really speak to what that really means in geographical terms. So what is the geographical coverage area where you guys can help?
So we go from Elk Grove up to Nevada City. In there is Roseville, Lincoln, Auburn. We also do Natomas, and then kind of the downtown Arden, Carmichael area. And then, up the 50 corridor, Fair Oaks, Citrus Heights, Folsom. We do a little bit into Amador County. Right now we can cover into Rancho Murrieta, not too much further than that. In El Dorado County, we can do El Dorado Hills, sometimes Cameron Park. For people who live in Sacramento, they know exactly what I'm talking about. And then, we will always look to, if it's outside of those areas, we'll definitely provide resources for you, or check and see what we can do. I'm always going to present what I can do rather than telling you what I can't, because sometimes I do have a caregiver that lives slightly outside of the area that might be able to help out. But we'll always be very transparent on how we can help.
Thank you for that. So talk about finding, I think it's important for people to understand that we this industry in general, right? We're always trying to do our best with this customized matchmaking process, right? Finding the right care professionals that has the right skill set, the right personality, right? Where this relationship between client and care professional forms, right? But I also would urge families to consider that if you are reaching out to a home care company, we always want that continuity of care as quickly as possible, but sometimes it's going to take a bit, right? Some caregivers need to be moved around. We have to find the right team of care professionals, especially if it's high hours. But the benefit to that, actually, for the family is that they get exposure to more care professionals so they can provide more feedback to us about what they like, what they don't like.
Yes, absolutely. And I tell families that. I say, even though in the first 2 weeks you may see a couple different faces, I actually like that. And I tell them why. I like that I can call you after each shift and say, well, what did you like and what didn't you like? And that can help us hone in. The other thing that makes kind of our platform a little unique is that families have an ability to favorite a caregiver that comes in. So if somebody comes to see you and you love them, you go into the system and you make them a favorite. And for the rest of the time that you're on care, if your regular ongoing care professional calls off, immediately a text or an email goes out to all of the care pros on your favorites list and gives them first dibs to pick that shift up.
Wow.
So the bigger your favorites list is, the more likely when there are, because there's always going to be call-offs, people get sick. We're very, very careful when it comes to illness. Symptoms, we've seen how fast illness can spread. So we're cautious. But now you're more likely to see somebody somebody you like. They get first dibs, and usually they're really excited. They're like, "Oh, Mrs. Johnson needs somebody. I get to go see her again," and they'll pick that up pretty quickly. So
that is fantastic. Is this a Homestead Honor unique?
It's part of the Honor platform. It's part of their AI technology. Okay. And how it's kind of changing the way we provide care. And that's one of the huge benefits is that favorites and just it automatically going out. I mean, because we've always kind of done that manually. You look and see who all's been there, and then you pick up the phone and you call them all. But now it just goes out to them automatically as soon as the other care pro takes themselves off the shift.
It's a much more efficient way.
It's efficient, and you're more likely to reach them. So it's just so quick. So I like that. And so I tell families, favorite them. If there's something you don't like, just communicate it to me. Every client I bring on has my cell phone number. I answer my cell phone all the time. They can call me and just let me know all of the things that they didn't like, and I'm going to do what I can as soon as I can to fix those problems for them.
I'm glad that you do that. I think something that doesn't get thought about sometimes is we assume that if somebody doesn't like a certain fit caregiver, that they're going to automatically reach out, they're going to complain, right? There's going to be these grievances. But when we think about this age demographic, they tend not to. And that's where you see situations where it's not the right fit, but it goes on. And next thing you know, they're cutting hours or they're ending the case, found a new agency. But if we can let them know up front that it is 100% safe to provide that feedback so we can make adjustments, that's what we want. I have also found situations where the reason why they don't give us that feedback is because they're almost afraid that if they give us the feedback and we don't change the caregiver, then there'd be some sort of retaliatory behavior.
Yeah. The other thing I hear a lot is, well, I didn't want to get her in trouble. I didn't want to get my care pro in trouble. And so they tell everybody, nobody gets in trouble. We're all adults. It provides an opportunity for us to train and to coach, which helps their caregiver become a better care professional moving forward. We're never punitive. We are invested in the growth of our employees, and you have to know where somebody's lacking in order to know where to focus that training, right? Otherwise, they're getting training on something they excel at and not getting training on an area where they're unsure. So, yeah. And
so the feedback loop is part of them actually helping us to edify our care professionals, which, it helps them in their overall career.
Yeah, it's just
never thought about it that way
for everybody.
So we brought up Honor, and I do know, right, you guys are one of the Homestead locations that is on the platform. Can you speak a little bit to the benefits of being on the platform?
Sure. The biggest benefit here in the Sacramento area is the sheer number of caregivers that they have on staff. We have access to so many care pros, and moving through COVID was such a hard time. There was a huge labor shortage, and we were turning clients away. We were partnering with other agencies, trying to piece together care. It was really difficult. And now somebody comes to me and I'm like, I don't tell them, well, you can only have care on these days at these times because that's what I can staff. I'm like, tell me what you need, and that's what I can provide. And it feels so good to be able to do that. The other benefits is they have a trust and safety team, which has nurses on staff 24 hours a day, and they're constantly looking at caregiver notes. They're available for care pros to call them and ask questions or get guidance, and so that's been really, really helpful. They send us messages. We noticed this in the care plan and we have a concern about this. Let's have them talk to their doctor about it. So it's really nice having those eyes on. It helps us do our job as a care manager a lot better. And then they're developing this new AI technology, which is taking all of this information that we put in to the system. So CarePro notes from their shifts, the notes that we put in for reassessments. It analyzes phone calls with family members. It looks at their schedules, their health conditions, like all of this different information. And then it tells us who's at high risk for things like hospitalizations and, ending care, or it provides recommendations. Maybe this needs to get involved, or, let's look at hospice. So we can.
That's really state of the art, because, I'm understanding the whole theory behind that is that by having that information and having it analyzed and the recommendations given to you guys, we can hopefully stay ahead of crises from happening.
Yeah. And it helps us provide better resources and get those resources in earlier. I talk to hospice representatives all the time. And one of the biggest pain points for a hospice agency is people wait until a day or two before they're going to pass. And there's so much more that hospice can do for a family, so much support, and it can just really improve the quality of life over those 6 months. And so if we can start to recognize earlier on when the support system is needed and get them in, it just makes everything easier for the family. It makes it easier for, the client. And, so, this honor is really helping us to look at that and hone in on that. And it's been a really incredible experience over the last year.
I'm so happy to hear that. I was aware that there were going to be some changes, as far as the AI, but it's super exciting. It sounds like it's closer and it's already starting to be executed. So I'm very excited to see the impacts on the agencies with that. So as a reminder, right, Jenn and Homestead, they cover Grass Valley, Sacramento,
Oak Grove. We call it the greater Sacramento area and the lower foothills.
And this is California for anybody that doesn't know when we say Sacramento, California area. Let's take it one other thing to touch on. So you described the process. Someone has some questions about their aging loved one. They reach out to you. There's a phone consultation. There's an in-person consultation, making recommendations on your services, the care plan, any other resources. But let's say somebody comes on care and they are matched with care professionals. What happens as they continue to be on care? Is there a way that you guys are reassessing? How do you ensure the quality of the care?
A lot of different ways. So we provide introductions. When a new care pro goes into the home, we will provide an introduction to make sure everybody's comfortable and that we set those expectations right there at the beginning of care. And then we check in a lot during those first couple of weeks. We check in by phone and we do an in-person visit. We want to make sure that our plan of care is accurate, that there's no surprises, and that everybody's getting into a good routine. And then after that, we do in-person check-ins every 60 days. We are looking to make sure our plan of care is accurate. We're looking to see if there's any resources needed, any change in condition. I'm also watching how a client and their care pro interact with each other, because like you said, a lot of our clients won't necessarily say if there's a problem. And so we know what to look for. So we're looking for signs, but we also want to know when they're doing an amazing job. And so one of my favorite things, pretty much every visit I go on, rave about, their care pro, and they're part of the family and they couldn't do anything without them, and, all of these things. And so we like to look for ways that we can reward our staff for providing exemplary care. And that's what those visits do.
That's so important. So Jenn, anybody that has been listening today and they want to connect with you, they want to talk to you about their aging loved one, or if they watch this recording later, how can they contact you?
The best way to get to me is my cell phone. I answer it all the time. So you can always reach out to me at 916-693-8415. You can also call our home office, and they can get you in touch with our intake coordinator, or you can actually talk directly to Buck, because he actually answers the phone. Buck is our intake coordinator.
Mr. Buckshaw.
But yeah, you can reach out to me via my cell phone or call our home office anytime. Phone call is definitely the best way to reach me.
Now let's talk about maybe how our audience can support you. What sorts of professionals in Sacramento, Grass Valley area, all of those towns that we mentioned, what sorts of professionals are you looking to connect with?
Anybody that can be a resource for our clients. We get asked a lot about trust and financial planning and estate planning. So that's a big area. Attorneys and financial planners that can help with those areas, as well as anybody that does home health or hospice. The more people we know in that area, the better. A lot of times, sometimes it's just they get assigned somebody from their doctor or from the hospital, and they ask us, is this company good? And I like to have something specific to tell them, because I can say, oh yeah, that's a great company, or it's, been in business for a long time. But I like to be able to say, I love this about this. I love these nurses, or, oh my gosh, their social worker is amazing and can help you so much. So the more I know who's out there, the more resource I can be to my clients. We also, moving companies, organizing companies. A lot of seniors tend to, I don't want to say they're hoarders, but they collect
have a high level of sentimental attachment to physical items.
And they've lived in their homes for 50, 60, 70 years. And, I moved out of my last house after 11 years, and I was like, how did I get so much stuff? Imagine if that was 70 years. So having people that can help with that is really important. But yeah, all of those different areas they're helpful to the people we work with.
They are. I would suggest, we have a comment. It just says Facebook user, so I can't tell who it is, but it says, we love to give our seniors options. That is so, so important. Thank you, whoever you are that left the comment. So as far as professionals, anybody listening, if you know the following types of professionals in Jenn's geographic territory, we're looking for estate and trust attorneys, trust litigators, aging life care managers, otherwise known as geriatric care managers. Would love to have some connections to financial planners, wealth managers, also private fiduciaries, any corporate trust officers, and of course, our placement professionals, home health, hospice. So the list goes on and on. But if any of you guys have connections with those types of professionals in Jenn's territory, please either let her know, you can let me know, so we can work together to provide that connection for her and the Shaw Home Instead office. Jenn, I really appreciate you being my guest today. You are so well-spoken, so passionate. Your reason for being in the industry earlier really moved me. I had goosebumps the whole time. So it's a pleasure to work with you, and I'll be talking to you soon.
Thanks, Sarah. Have a great day.